Good evening, good afternoon, and good morning. The 1590th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Deepak Kumar Tyagi. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathy lovers, students, and doctors. And we have 3 sessions every day. The first session of the day in Hindi is already over from 7:30 to 8:30. From 8:30 to 9:30, we have an international session in English. And 9:30 to 10:30, local language session in Malayalam. All the videos of the same will be uploaded at YouTube at IFPH Homeopathy. You can search it and subscribe it of the world. This is the purpose of International Forum for Promoting Homeopathy. And let me come to today's guest. As you know, today our guest is Dr. Deepak Kumar Tyagi, who has completed his MD. Has completed his BHMS and now doing his MD in practice of medicine at the Calcutta Homeopathic Medical College Hospital. So let us see how we present a paper on valvular heart disease and its homeopathy. As you all know that homeopathy is effective in all kind of diseases, particularly those suffering from heart diseases. Homeopathy can do a lot of work in that, and thereby avoiding surgeries on heart as well as even particularly in children we can manage, we can avoid lot of surgeries on different situations in connected with heart diseases. So we proudly welcome the guest of the day, Dr. Deepak Kumar Tyagi. Welcome, doctor. You can begin the session and you can speak for 45 minutes. Then we will have a discussion later on the subject. And by in that time, those who want to ask questions as well as want to add anything more on that can do these things. So you can begin, Dr. Tyagi.
Very good evening to everyone. My name is Dr. Deepak Kumar Tyagi. I have done my BHMS from Dr. B.R. Homeopathic Medical College and Hospital, and currently I am pursuing my MD in practice of medicine from the Calcutta Homeopathic Medical and College and Hospital. First of all, I would like to thank IFPH platform for giving me this opportunity. So without further ado, we would like to begin our sessions. But sir, my audio is visible? Am I audible?
Yes, everything is fine. Now you
But
can,
sir, I am not able to share the screen.
because
How will I share my screen? I'm not able to share the screen because I have prepared the PPT. Now it is visible or not?
you must stop screen sharing. Yes, now it is visible.
Okay, so let's begin the session. So today my topic is recent updates in diagnosis and treatment of valvular heart diseases, the scope of homeopathic treatment. So first of all, I would like to give the layout that how I'm going to proceed during my presentation. So first of all, I would like to tell about the what are heart valves. Not just a second. Yeah. Now I'm audible. Video is visible. Video and audio are clear.
Everything is fine. You can,
Okay, sir. So first of all, I would like to give the layout of my seminar. That first of all, I will discuss first about what are heart valves, how many types, how do heart valves works, its anatomy and physiology, what is valvular heart diseases, types of valvular heart diseases, what causes heart valve disease, detailed explanation of valvular heart diseases. Next, I will talk about recent updates in diagnosis and treatment of valvular heart diseases, its miasmatic analysis, of valvular heart disease and related therapeutics, and what is the scope of homeopathy in valvular heart diseases. So first of all, we will talk about what are heart valves, what is its anatomy. So as we all know that we have four heart valves. In right atrium and right ventricle, in between that we have our tricuspid valve. Tricuspid valve has three cusps. And in between left atrium and left ventricle, we have mitral valve. In between right ventricle and pulmonary aorta, we have pulmonary valve. And in between left ventricle and systemic aorta, we have aortic valve. So this is known as anatomy of heart valves. So next, I'm going to talk about what is pulmonary circulation and what is systemic circulation. What happens is when deoxygenated blood comes from superior vena cava and inferior vena cava, and it will go to right atrium. Okay, then from right atrium, this deoxygenated blood will goes to right ventricle with the help of tricuspid valve. Then this deoxygenated blood, which is in right ventricle, will goes to pulmonary aorta with the help of pulmonary valve. Then this deoxygenated blood will goes to lungs where it gets oxygenated. Then this oxygenated blood will go to left atrium with the help of pulmonary veins. After coming to left atrium, this oxygenated blood will go to left ventricle with the help of mitral valve. Then this deoxygenated blood we will have in left ventricle will go to systemic aorta with the help of aortic valve. And then this oxygenated blood will circulate in our body according to the needs. So this is the detailed explanation of pulmonary circulation and systemic circulation. Next, I'm going to talk about valvular heart diseases and its types. Basically, valvular heart diseases are of two types. First is stenosis. Stenosis means valve is not opening properly. And second one is regurgitation. Regurgitation means valve is not closing properly. Okay. So what are the types of valvular heart diseases? As I already tell, there are mitral valve, tricuspid valve. So according in mitral valve, we have mitral stenosis, mitral regurgitation is there, mitral valve prolapse is there. If I talk about tricuspid valve, tricuspid stenosis is there, tricuspid regurgitation is also there. If I talk about pulmonary valve, pulmonary stenosis is there, pulmonary regurgitation is there. If I talk about aortic valve, aortic stenosis is there, aortic regurgitation is there. This pulmonary valve and aortic valve are also known as semilunar valves. So first we're going to talk about mitral stenosis. So normal surface area of mitral valve is 4 to 6 centimeters square. This is the mitral valve anatomy. As you can see over here, this is the anterior commissure and this is the posterior commissure. In the initial slides, I told you that tricuspid valve has three cusps, but the mitral valve has two cusps. You can see the two cusps over here. Just look at this arrow. This is the anterior lateral papillary muscles of the mitral valve, and this one is the posterior medial papillary muscles. So this is the mitral valve anatomy. Next is what is the etiological factor of mitral stenosis. Most common cause of mitral stenosis is rheumatic fever. There are many other causes also. For example, connective tissue disorder is there, radiation is there, carcinoid syndrome is there, valve calcification, ball valve thrombus, atrial myxoma. But the most common cause is rheumatic fever. Now, what is the pathophysiology of mitral stenosis? See, look at whatever these valvular heart diseases are, they have more or less same kind of pathophysiology. So I will explain this mitral stenosis pathophysiology. What happens is when valve is stenosed, look this thing. When valve is stenosed, so blood which is present in left atrium will not go to left ventricle. So it will create back pressure to the pulmonary capillaries, which will in turn lead to pulmonary edema, which will lead to further dyspnea. Pulmonary edema will lead to back pressure, will give back pressure to pulmonary aorta, which will lead to pulmonary hypertension. which in turn lead to pulmonary regurgitation. Due to pulmonary regurgitation, pressure will increase in right ventricle, which in turn lead to functional tricuspid regurgitation. Then this blood, which is present in right ventricle, it will leak to right atrium through tricuspid valve because it is regurgitating. Then this pressure will increase in right atrium, which in turn lead to systemic venous congestion, which will lead to, for example, hepatomegaly and splenomegaly. So this is the pathophysiology of mitral stenosis. Now, what are the signs and symptoms of mitral stenosis? So I have learned this with the help of the mnemonic known as stenosis. So in this, S means S1 is initially loud, but later on soft due to calcification. In the initial cases of mitral stenosis, S1 is initially soft, but later on due to calcification, sorry, in the initial cases of mitral stenosis, S1 is initially loud, but in the later cases of mitral stenosis, it will become soft. Why it will become soft? Because calcified valve will come close to each other, and when they will hit, it will produce a soft sound. That is why in severe cases of mitral stenosis, the S1 will become soft. And next is T. T is meant tapping apex beat. Where we will find tapping apex beats? In the left fifth intercostal space, medial to mid clavicular line. What is meaning of E? E is enlargement of left atrium. N is normally split S2. O is opening snap. Opening snap means whenever this calcified valve will open, it will produce some kind of sound. That sound is known as opening snap. And O also means Ordner syndrome. Here I mentioned that E is enlargement of left atrium. This enlarged left atrium will give pressure to recurrent laryngeal nerve, which will lead to hoarseness of voice. That is known as Ortner syndrome. Then S means straightening of left heart border. I means interstitial edema, and S means stenosis. Now this is the X-ray of mitral stenosis. Here you can see that prominent left atrial appendage, pericardial calcification is there, cardiomegaly is there, and this right atrium and left atrium, this forms the double right heart border. And these are the ECG findings. What is the main ECG finding of mitral stenosis? You can check in lead 2. Here you can see this P in the P wave in the form of M. This is known as P mitral. Basically, in normal ECG, P wave is having time of near around 80 to 120 millisecond. But in case of mitral stenosis, this P wave is more than 120 millisecond, which is known as P mitral. But the investigation of choice in case of mitral stenosis is transthoracic echocardiography, in which you can find out a hockey stick sign. This is the most important sign in the case of mitral stenosis. You can see it over here. This one, it is looking like in hockey, no? So this is known as hockey stick sign. In this, anterior mitral valve leaflet has restricted motion due to less space, and it appears like in hockey. So this is known as hockey stick sign. This is the color Doppler. You can see it over here that mitral valve was fully calcified. Now the classification on the basis of severity of mitral valve stenosis. Basically, we will classify this mitral valve stenosis in the severe form, moderate form, and mild form. What is mild form? If the valve size is less than 2 centimeter square, but more than 1.5 centimeter square. What is moderate? Moderate is less than 1.5 centimeter square. And what is severe? Less than 1 centimeter square. Now, what are the complications of mitral stenosis? I told this already that when the mitral valve is stenosed, it will lead to increase in left atrial pressure, which will lead to pulmonary venous hypertension, which will lead to right ventricular hypertrophy, right ventricular dilatation, tricuspid valve ring dilatation, and functional tricuspid regurgitation. And another complication is left atrial dilatation, which in turn lead to atrial fibrillation also, and stasis of blood, thrombus formation, and systemic embolism. Now, what are the differential diagnoses of mitral stenosis? For example, left ventricular systolic function, aortic valve disease, presence of mitral regurgitation, diastolic left ventricle function, rare case of atrial myxoma or other atrial tumor, rare cause called tritium. Now, what is the treatment approach in case of mitral stenosis? Basically, in this type of cases, our conventional treatment are doing percutaneous mitral balloon malcommissurotomy in the moderate and severe cases. Now, mitral regurgitation. What I told in the initial slides, what is the meaning of regurgitation? Regurgitation means valves are not closing properly. So, what are the causes of mitral regurgitation? There are so many causes. Some of the important causes are endocarditis, papillary muscle rupture, trauma, chorda rupture, myxomatous degeneration, rheumatic fever, endocarditis, mitral annular calcification, congenital defect. Now, what happens in mitral regurgitation, pathophysiology? Whenever the valves are not closing properly, for example, this is mitral valve and downward is left ventricle. So when the valves are not closing properly during contraction, what happens is some amount of blood will go to systemic aorta with the help of aortic valve, and some amount of blood will leak back to left atrium with the because mitral valve is not closing properly during the contraction phase. So when the blood is going back to left atrium, it will create pressure over there because blood is coming also from pulmonary veins. So it will lead to increased left atrial pressure, which in turn lead to increased pressure in pulmonary system, which in turn lead to pulmonary hypertension. And again, same pathophysiology, which in turn lead to increased pressure in right ventricle, then right atrium, then systemic venous congestion, also increased jugular venous pressure. Now, what is the symptoms of mitral regurgitation? When blood will there is increased pressure in the pulmonary system, it will lead to dyspnea. Other symptoms are edema, ascites, palpation, fatigue. What are the signs we will get? Atrial fibrillation we will get, cardiomegaly, apical pansystolic murmur. In case of mitral regurgitation, we will get pansystolic murmur. And other condition in which we will get pansystolic murmur is tricuspid regurgitation and ventricular septal defect. But in case of mitral stenosis, we will get mid-diastolic murmur. What is the management of mitral regurgitation? Mitral regurgitation, same. In case of mild treatment, they will treat with the help of medication. But in case of moderate and severe cases, they will go for surgical repairment. Now, mitral valve prolapse. What do you mean by mitral valve prolapse? During late systole, the mitral valve leaflets cove back into the left atrium. So what are the causes of mitral valve prolapse? One of the most important cause of mitral valve prolapse is myxomatous degeneration of leaflets. Now, here, what is the most important thing? Clinical manifestation is we will get fatigue, shortness of breath, lightheadedness, dizziness, syncope, palpitation, chest pain, anxiety, and murmur of mitral regurgitation, mitral valve prolapse is late systolic murmur. This is the most important finding in mitral valve prolapse. Now we will go to talk about aortic stenosis. Aortic stenosis means that aortic valve is not opening properly. What is the most common cause of aortic stenosis? Well, in case of children, bicuspid aortic valve is the most common cause of aortic stenosis. But in case of adults, calcification, or you can say that atherosclerosis, is the most important cause of aortic stenosis. Now, pathophysiology, when aortic valve is stenosed, so what it means that left ventricle, when it is contracting, it is not pushing the blood into the systemic aorta because aortic valve is closed. So what happens is it will lead to increased left ventricular and diastolic pressure, which in turn lead to left ventricular concentric hypertrophy, which in turn lead to left atrial dilatation, then left ventricular eccentric hypertrophy, which in turn lead to functional mitral regurgitation, which in turn lead to post-capillary pulmonary hypertension, tricuspid regurgitation, right ventricular dysfunction. I told you that these valvular heart diseases have more or less pathophysiology, their pathophysiology are same. Now, the clinical manifestation of aortic stenosis, we can remember this by the mnemonic SAD, in which S means syncope, A means angina, D means dyspnea. And here we will get slow rising pulse. This is the most important sign of aortic stenosis. Slow rising pulse, or it is also known as pulsus parvus et tardus. And what about this murmur? What kind of murmur we will get in aortic stenosis? It is mid-systolic murmur. Now the physical examination of aortic stenosis. So what happened normally in whenever what happens in mild cases, there is paradoxical split in case of aortic stenosis, because valve is not closing properly, so it A2 will delay and P2 will come in front. So this is known as paradoxical split. So in case of aortic stenosis, we will get paradoxical split. Now, what is the management in case of aortic stenosis? In mild cases, there is only conventional medical treatment, but in case of moderate and severe, there is balloon dilatation of aortic valve. I will explain in further slide that how this happens. Now, aortic regurgitation. Aortic regurgitation means valve is not closing properly. So what happens is, when valve is not closing properly, whatever blood which is present in systemic aorta during relaxation phase, it will leak down to left ventricle. And what is the common cause of aortic regurgitation? That is rheumatic heart disease, infective endocarditis, congenital degenerative diseases, aortic diseases, connective tissue diseases, and aortitis. Now, pathophysiology, which is I'm talking about, incomplete closure of aortic valve will lead to backflow of blood to left ventricle, which will lead to left ventricular hypertrophy and dilatation, which in turn lead to left-sided heart failure and decreased cardiac output. And next is increased left atrial pressure, which in turn lead to left atrium hypertrophy, which in turn lead to increased pulmonary pressure, increased right ventricular pressure, and right-sided heart failure. Now, these are the most important signs in case of aortic regurgitation. First is Corrigan pulse. It is also known as water hammer pulse or collapsing pulse. It is another name of Corrigan pulse. What is this? Rapid and forceful distension of arterial pulse with quick collapse. Next sign is DEEPAK sign, to and fro head bobbing for like this. Next is Muller sign, visible pulsation of uvula. Next is Quincke sign, capillary pulsation seen on light compression of a nail bed. Next is Trobe sign, systolic and diastolic sound over the femoral artery. We can hear a pistol shot like sound in the Trobe sign. What is Durozius sign? Broods heard over femoral artery on light compression by stethoscope. And what is Hill sign? Popliteal cuff pressure exceeding brachial pressure by 60 mm of Hg or greater. Now, physical examination. In case of aortic regurgitation, we will get wide pulse pressure and high-pitched early diastolic murmur, ejection systolic at base and into neck, and mid-systolic rumble at apex. Now, in case of same, what we do in case of aortic regurgitation, according to conventional treatment, in case of mild and moderate, they will give their medical management, but in case of severe, they will go for surgical repair. Now, what is tricuspid stenosis? Tricuspid stenosis means that valve is not opening properly, tricuspid valve. What are the causes? Causes are rheumatic heart diseases, rheumatic heart diseases, infective endocarditis, right atrial myxoma. What in turn, when valve is not opening properly, so right atrial pressure will increase. Okay, I'm telling about the pathophysiology of tricuspid stenosis. When the valve is not opening properly, it will lead to increased pressure in right atrium, which in turn lead to increased JVP pressure. Here I have mentioned this. Increased JVP is elevated with giant A wave. Whenever JVP is elevated, it will produce giant A wave. And what kind of murmur we will get in case of tricuspid stenosis? Same as in case of mitral stenosis, we are getting mid diastolic murmur. Here we are also getting mid diastolic murmur. And what is the investigation of choice in case of tricuspid stenosis? It is echocardiography. And what are the kind of treatments they are given in cases of tricuspid stenosis? That is diuretics they are giving. What is the help? What is the use of diuretics? What they are doing in our body? Diuretics will excrete out the extra amount of fluid from our body. I will give you one example. Thiazides. What thiazides are doing in our body? Thiazides in the loop of Henle, they are there is some kind of potassium, sodium, and chloride channel. They dysfunction this channel, and through this, when they dysfunction this channel, thiazides, all the water which is present in the excess amount in our body will leak out through the urine. So in this way, it will this diuretics will help to excrete out or eliminate the excess water from our body. Or they are doing bioprosthetic valve. Pathophysiology I already told you. Now, what are the clinical manifestation of tricuspid stenosis? Symptoms we will get: hepatomegaly, ascites, peripheral edema, neck vein enlargement, decreased cardiac output. And what are the signs we get? Raised GVP and mid diastolic murmur. What is the physical examination findings? Abnormal pulse elevation in jugular vein of neck, abnormal heart sound and murmur. What are the investigation? In case of chest X-ray, we will get increased atrial size with increase, right atrium size with increase, because tricuspid valve are stenosed. So whenever it is contracting, it is pushing more pressure, which in turn lead to left atrial, right atrium hypertrophy. After that, it will lead to dilatation. And what we will get in ECG? Tall PVS we will get. Cardiac catheterization we are also doing in this case of tricuspid stenosis, MRI, CT, and what we will get in echocardiogram? Thickened immobile tricuspid valve. Now, what is the treatment in case of tricuspid stenosis? Well, this treatment is divided into two parts: medical treatment and surgical treatment. Well, medical treatment comprises of antibiotics, diuretics, anticoagulants, antiplatelets, vasodilators, and cardiac glycosides. And what is mentioned in surgical treatments? It is annuloplasty, valvuloplasty, replacement of heart valve, and commissurotomy. Next is tricuspid regurgitation, which means that tricuspid valve is not closing properly. What are the risk factors of tricuspid valve regurgitation? These are Epstein anomaly, rheumatic heart diseases, infective endocarditis, heart failure, pulmonary hypertension, chest injury. Now, what is the pathophysiology of tricuspid regurgitation? Same. When tricuspid valve is not closing properly during the contraction phase, when right ventricle is contracting, try to push blood into the pulmonary aorta. Some amount of blood during contraction phase, some amount of blood will go to pulmonary aorta, and some amount of blood will leak back to right atrium, which in turn increase the pressure in right atrium, which in turn increase the systemic venous congestion and increase GVP. Then hepatomegaly, splenomegaly, same pathophysiology. What are the signs and symptoms of tricuspid valve regurgitation? That is right-sided heart failure and right-sided congestion, shortness of breath, weakness, reduced urinary output, ascites, liver dysfunction, fatigue, weight loss, and active pulsation in the neck veins. What are the physical examination findings of tricuspid regurgitation? That is increased JVP, pansystolic murmur. These are the findings. Now, what are the diagnostic techniques? We can do echocardiogram, we can do ECG, chest radiography, hemodynamic study, MRI. Now, what is the conventional treatment in case of tricuspid regurgitation? They are doing, I told you in initial slides that tricuspid valve has three cusps. So what they are doing, for example, these are three cusps of tricuspid valve, and where these cusps are leaking. So according to conventional treatment, what they are doing, they are tying the thread in these three cusps, so that valve will not regurgitate. With the help of thread, they are tying these three cusps so that valve will not regurgitate, and this is known as transcatheter treatment. Now, pulmonary valve stenosis, it means that pulmonary valve is not opening properly. What are the causes of pulmonary valve stenosis? We can learn it with the help of mnemonic WAND, in which W means Williams syndrome, A means Algalis syndrome, R means rubella, N means Noonan syndrome, and E means ED means Ehlers-Danlos syndrome. Now, what is the pathophysiology of pulmonary stenosis? Same. When valve is not opening properly, it will lead to increased pressure in right ventricle, which in turn lead to functional tricuspid regurgitation, then increased pressure in right atrium, then systemic venous congestion, hepatomegaly, splenomegaly, and increased JVP. Then what are the signs and symptoms of pulmonary stenosis? Symptoms are easy fatigue, difficulty in breathing on exertion, loss of consciousness on exertion, bluishness of lips and fingers, which is known as cyanosis, poor weight gain, liver enlargement, ascites, fluid collection in abdomen. And what are the signs we are getting? Single second heart sound in case of tricuspid, in case of pulmonary stenosis. Ejection systolic murmur we will get, and decreased oxygen percentage in blood in infants. Now, what are the findings we will get in physical examination? With moderate or severe pulmonary stenosis, a right ventricular impulse at left sternal border, thrill at the second left intercostal space, harsh crescendo and decrescendo systolic murmur. If the valve is pliable, an ejection click often precedes the murmur. As the stenosis becomes more severe, the systolic murmur peaks later in systole. There are 4 heart conditions in which we will get mid-systolic murmur. These are aortic stenosis, pulmonary stenosis, hyperobstructive cardiomyopathy, and tetralogy of Fallot. These are the 4 conditions in which we will get ejection systolic murmur, or it is also known as mid-systolic murmur, or you can call this murmur also, this murmur is also known as crescendo or decrescendo murmur. Now, what are the investigation in cases of pulmonary stenosis? We can go for chest X-ray, in which we will get prominent pulmonary artery owing to post-stenotic dilatation. What are the findings we will get in ECG? Both right atrial and right ventricular hypertrophy, although it may sometimes may be normal in severe pulmonary stenosis. But in this pulmonary stenosis, echocardiogram Doppler is the investigation of choice, and we can also go for cardiac catheterization. Now, what is the management in case of valvular pulmonary stenosis? In mild cases, same medical management. In moderate cases and severe cases, they are going for balloon dilatation of pulmonary valve. Now, pulmonary regurgitation. It means that pulmonary valve is not closing properly. Pulmonary regurgitation is a leaky pulmonary valve. This valve helps control the flow of blood passing from the heart to the lungs. A leaky pulmonary valve allows blood to flow back into the heart chamber before it gets the lung for oxygenation. Most common cause in case of pulmonary regurgitation is ring dilatation due to pulmonary hypertension or dilatation of pulmonary artery secondary to a connective tissue disorder. It may be present and well tolerated for many years. The clinical manifestation of primary disease tend to overshadow the pulmonary regurgitation. Now, same they are doing. What is the management? When the pulmonary regurgitation valve is not closing properly, whatever amount of blood is leaking in the right ventricle, what the conventional treatment is doing, they are they are doing the surgical repairment of this valve. Now, what are the signs and symptoms? So, symptoms are dyspnea on exertion, fatigue, syncope, angina, hemoptysis. And what are the signs? Increased jugular venous pressure, prominent right ventricular impulse, accentuated pulmonic valve component, that is P2, right-sided third heart sound we will hear, tricuspid insufficiency murmur, hepatomegaly, and peripheral edema. What are the findings in case of physical examination? There is right ventricular heave we will get, high-pitched blowing, early diastolic decrescendo murmur. In case of aortic regurgitation and pulmonary regurgitation, we will get early diastolic murmur. It is also known as decrescendo murmur. What are the investigation in case of this? We can do ECG also, chest X-ray also, cardiac MRI also. Treatment part, same I told you that they are going to surgically repair. In case of regurgitation, they are going to surgically repair the valve. Now, the recent updates in diagnosis and treatment, as we have less time, so I am skipping these slides. In this slide, I have put some questions, but we don't have enough time, so I am skipping these slides. So, what are the recent updates in diagnosis and treatment of valvular heart diseases? First is key echocardiographic consideration for tricuspid valve transcatheter edge to edge repair. I told you in case of tricuspid regurgitation, for example, we are having these three valves, 1, 2, and 3. And our valves are leaking. Tricuspid valves is leaking. So what they are doing, according to conventional treatment, they take a thread and they tie around these valves so that valve will not leak back. So this is known as transcatheter edge to edge repair. What is second one is transcatheter aortic valve replacement. What they are doing during this minimally invasive procedure, a new valve is inserted. You are seeing over here with the help of the balloon, they are inserting a new valve without removing the old. They are putting this new valve over the deceased valve. A new valve is inserting without removing the old and damaged valve. The new valve is placed inside the deceased valve, and the surgery may be called a transcatheter aortic valve. What they are doing with the help of this catheter you are seeing over here, this catheter comes over here, then they dilate the balloon. After the dilatation, they are putting artificial valve over the deceased valve. And when the artificial valve is put on the deceased valve, they remove this catheter, and then artificial valve will work according to its function. So this is known as transcatheter aortic valve replacement. Next one is multimodality imaging in case of aortic stenosis. Well, there are several imaging modalities. For example, transesophageal or stress echocardiography, computed tomography, cardiovascular magnetic resonance, and positron emission tomography exist that allow a detailed assessment of stenotic aortic valve and the myocardial remodeling response. This review aims to provide an updated overview of these multimodality imaging techniques and seeks to highlight a practical approach to help clinical decision making the challenging group of patients with discordant low gradient aortic stenosis. What they are trying to say that with the help of these different kind of investigation, they can assess the severity of aortic stenosis, that how much our aortic valve is stenosed. Next is artificial intelligence and automation in valvular heart diseases. As we all know, then in today's world, artificial intelligence is using everywhere. Artificial intelligence covering every field. So they are entering in the investigation and diagnostic procedure also. So if we are looking this electrocardiogram and variables, what is the use of AI over here? Detection of structural heart diseases from 12-lead ECG, detection of atrial fibrillation. They are enhancing the diagnostic procedure. AI, what they are doing, they are enhancing whatever diagnostic techniques we are having in the earlier days. AI is enhancing these diagnostic procedures. Detection of atrial fibrillation variable smartwatch, screening for asymptomatic left ventricular dysfunction. In the echocardiograms, what AI is doing, cardiologist agreement on left ventricular ejection fraction greater with AI versus sonographer, diagnosis of HCM and CA from other causes of LVH, novice user assisted to quickly and accurately assess LV. In cases of MRI and nuclear and CT, auto assess coronary calcium on all CT scans to find untreated CAD, perivascular fat attenuation index on coronary artery CTA to predict mortality, and AI-based virtual native enhancement replacing LGE on CMR. In cases of coronary angiography, automated left ventricular ejection fraction calculation without requiring ventriculogram, prediction of MACE based on plaque morphology on angiography, and coronary artery stenosis localization and estimation during LSC. So, what AI is helping? AI is just enhancing the diagnostic techniques. So, we will get the through which we will get to know that whether that person is suffering from any kind of heart diseases or not. Now, fifth one is Valve Academic Research Consortium. So, after putting the bioprosthetic means artificial valve, after putting the artificial valve, we will have to follow up this patient. There are several stages over here. In stage 0, patient has to come yearly clinical and echocardiographic follow-up. Stage 1 is repeat echocardiography 3 to 6 months. After putting the artificial valve, patient has to go these stages. Repeat echocardiography in every 3 to 6 months after initial diagnosis. Trial of anticoagulation in leaflet thickening is suspected. What is stage 2S? Repeat echocardiography in every 3 to 6 months after initial diagnosis. Then if stable, every 6 to 12 months. What is stage 2R? Repeat echocardiography every 3 to 6 months after initial diagnosis. Then if stable, every 6 to 12 months. Then 2RS is clinical evaluation every 3 to 6 months in whatever patient that is stenotic artificial valve we have placed. There is clinical evaluation every 3 to 6 months whether that valve is functioning properly or not. Repeat echocardiography in every 3 to 6 months after initial diagnosis, and consider intervention if symptomatic. And what is stage 3 is consider intervention if asymptomatic with preserved LVEF, that is left ventricular ejection fraction. Consider clinical evaluation every 3 to 6 months and repeat echocardiography every 6 months. Now, the miasmatic analysis of valvular heart diseases. Well, in cases of SORA, any cardiac pathology caused by emotional disturbances like anger, anxiety, worry, grief, heart affections included valvular heart diseases from fear, disappointment, loss of close one or overjoy. What are the complaints we will get in case of SORI condition? For example, dyspnea we will get, palpitations we will get, which are better by lying down and keeping quiet and worse after eating. Neuralgia and stitching pain in the chest, which is ameliorated by rest, and band-like sensation around the heart. But I would like to say over here one more thing, that these valvular heart diseases, they have predominant miasm, psychosis. What are the complaints and what are the diseases which comes under psychotic miasm? That is, dyspnea is seldom painful as opposed to the psoric or tubercular miasm. There may be soreness and tenderness and pains radiating from heart to scapula or from shoulder to heart. The pain are aggravated by motion, walking, riding. And what are the heart complaints we will get in these kind of psychotic cases? For example, we will get infective endocarditis. For example, we will get rheumatic heart disease, atherosclerosis we will get. The heart complaints may be accompanied by pulse, soft, slow, and easily comprehensible. Psychosis produce marked anasarcum. Syphilis, the syphilitic incidence in cases of cardiac disorders lead to widespread destructive changes in the vital organs like heart, kidney, retina, and brain. Fibrinoid necrosis of vascular valve. Then left ventricular hypertrophy. Many of the life-threatening complications like cerebral edema, myocardial infarction, malignant hypertension, and very little mental disturbance in heart troubles, even at critical periods. And what are the symptoms in cases of pseudosora? Pulse is small, thread-like and quick. Wide fluctuation in blood pressure to very high levels of systolic and diastolic pressures. And along with hypertension, hemorrhagic manifestation. In cases of pseudosora, hemorrhagic manifestations are very important. And what are the hemorrhagic manifestations we are getting over here? That is epistaxis, retinal hemorrhage, cerebral hemorrhage. Vertigo and palpitation are greater than that seen with soric predominance and are accompanied by a rush of blood to heart and chest. Well, pain in chest is worse on sitting, better by lying, and is so severe that is associated with dimness of vision, ringing in ears, and great weakness. Now, what are the homeopathic drugs which are helpful in preventing cardiovascular disorders? First is Adonis vernalis, in which Dr. Boger says heart is weak, fatty, arrhythmic. Dr. Boric writes it is a heart medicine where the muscles of the heart in a stage of fatty degeneration regulates the pulse and increases the power of contraction of heart. Next one is amyl nitrosum. According to Dr. Boger, it is helpful in tumultuous palpitation, constriction of heart, and full and soft pulse. And according to Dr. Allen, it rapidly dilates the arteries, craves for fresh air. It is helpful in cases of angina pectoris, intense throbbing of heart and carotids. Next medicine is apocynon. Dr. Boger, according to Dr. Boger, it is helpful in operation of chest. Pulse is slow, fluttering, and irregular. And according to Dr. Boric, it is helpful in cases of arrhythmia, mitral, and tricuspid regurgitation. The next is cactus. According to Dr. Boger, it is helpful in constriction of heart. Body feels tight, irregular circulation. Heart feels clutched and released alternatively by an iron hand. And according to Dr. Allen, operation of chest is from a great weight, palpitation day and night, worse when walking and lying on left side. Convallaria majalis, according to Dr. Boger, it is a heart remedy which increases the energies of heart action, sensation as if heart keeps beating, then started very suddenly. And according to Dr. Clark, it is a remedy which is helpful in affection of heart diseases, and convallaria is a popular remedy in Russia for heart affections. Next one is Crataegus. Dr. Bogan writes that it is a very beautiful medicine in cases of cardiac dyspnea and incompetent valves. And according to Dr. Boric, it is helpful in cases of arteriosclerosis. It is having very beautiful solvent power to dissolve the calcium which is deposited in our arteries. In cases of atherosclerosis, this medicine is very useful, Crataegus. But according to Dr. Boric, it is a heart tonic arteriosclerosis said to have a solvent power upon crustaceous and calcareous deposit in arteries, heart dilated, first sound weak, pulse accelerated, irregular, feeble, intermittent. Digitalis, Dr. Boger says that it is helpful where heart is slow, weak, feels like stopping, must walk about with precordial anxiety, and slow and intermittent pulse. According to Dr. Allen, pulse is intermitting every third, fifth, or seventh beat. This is a very important symptom of digitalis. That pulse is intermitting is every third, fifth, or seventh beat. Now, what is the scope of homeopathy in cases of valvular heart diseases? Well, homeopathy treats the person as a whole. It means that homeopathic medicines for heart diseases focuses on the patient as a person as well as his pathological condition. The homeopathic medicines for heart diseases are selected after a full individualizing examination and case analysis, which includes the medical history of the patient, physical and mental constitution. A miasmatic tendency is also often taken into account for the treatment of chronic conditions. In homeopathy, health indicates harmonious functioning of vital force, and disease is considered as deviation from health. When the harmonious functioning of vital force is obscured, homeopathy treats the sick individual, not only his sickness. As stated in Hahnemann's writing, there is no disease but sick people. Well, in severe cases of surgical treatment, Well, in severe cases, this in cases of severe valvular heart disease cases, surgery is the only choice of treatment. But still, homeopathy can offer a palliative care of treatment. Now, I'm going to mention some cases where homeopathy is showing the beautiful results in cases of valvular heart diseases. First is this case, homeopathy in case of cardiac arrhythmia. These cases I have taken.
Yes,
Yes,
doctor, there is only just 9 minutes remaining. And
yes, sir. I'm going to finish it within 5 minutes.
okay, we need the discussion time for also. So if you can have another session, we can go ahead in that way,
Okay,
because
sir. No problem.
we can arrange a session in the coming
No
month.
problem. No problem.
Okay, since it is a big subject and it is you are speaking in a very, very fine mood, and your presentation was really excellent. And
Thank you so much.
you have tried to cover almost all these things. Okay. Uh, so it's the time for discussion. Those who want to participate in discussion may raise your hand so that have we can ask your questions also. As we all know that homeopathy is a science which treats the patient and not the disease. So that's the reason why we are able to cure such wonderful cases in whether it be a surgical one also. But of course, surgery is sometimes needed, but not always. We can avoid some surgeries also. Is Dr. Sunil Raj? Sir, you can say add something more on that. Or
Uh, good evening, all dear friends. So very excellent presentation from Dr. Tyagi. DEEPAK
Thank you
Tyagi.
so much, sir.
Very
Thank you
good
so much.
presentation, very good presentation. And he is able to cover all the malware related complaints and what homeopathy.
I cover it all the topics in a very fast manner. I want to explain in full detailed manner, but I'm not able because time constraint is there. That's why.
Okay. And he was covering the homeopathic aspects also, the miasmatic aspects also. So very good presentation, sir. Very good.
Thank you so much.
Excellent. Excellent.
is another person is Dr. Manoj.
Thank you, Dr. Tanesh. We are fortunate to have such this person, Dr. Deepak Tyagi, so doing wonderful job. We all know that after this COVID vaccination, the number of heart diseases and heart patients are increasing. So
Yes,
what we desperately needed is more more studies, especially more courses should be designed so that each and every person can study well. And so moreover, we can give good service to common man with the homeopathic medicines. That too we really proved one. Not at all harming the patient. You mentioned about around 8 or 9 medicines, their indications. This much of medicines, pure medicines, proved medicines, we cannot see in any other systems. So we must capitalize on that advantage, plus your efforts. Congratulations, and as well as we know the role of miasm, especially zygotic miasm in heart diseases, then the rheumatic heart disease, all these things together, we can do a wonderful job in homeopathic heart disease. Okay, thank you.
so I would like to add one thing.
Yes.
Yes,
With due respect, sir, as sir is saying that in cases of after the COVID vaccine, the main factor over there is fear. As lot of persons having fever that they will not get corona, so because of the fear in their mind, this is the most important factor in the cases of after COVID vaccination. Lot of persons suffering from heart attack. The most important cause is fear over there.
Moreover, the myocarditis is a major factor. Recent days, a lot of persons are perishing to this deadly vaccine. You can't ignore that.
yes. Not only that, the fear is only one thing, but the main thing is not the medication that were used for this vaccination. It was not at all a right medicine. We can say, for as it is a vaccine, it was never a vaccine. It was just something that injected, and they made it in a short time, and they supplied
So yeah,
everywhere, and then they just give trick to everyone. And they were waiting, but after vaccination, as you all know, that the number of COVID cases on the rise, and as a result, they published that it is the first wave. That the first wave was really produced by the vaccination, and after some time, so they after some more months, then they say that the vaccine is not working. Now we need another vaccine, so they put the second vaccine, and as a result of the second vaccine, the second wave occurred, because most people who took the vaccine at the time developed symptoms of COVID, and as a result, they were able to transmit into the to their friends and family members, and that's how the second wave happened. And this is what they have done with COVID, and as a result, well, not only that, it has a very long time impact. Even still, we can see lot of patients are getting cardiac arrest, cardiac problems there, as well as stroke like problems, because number that too in young persons, not only in old person, but the patient persons from the age of 30 to 60, the number is on a very big rise. So these are the troubles of this kind of vaccination. Anyway, it is a time for Dr. Hibbert to add something more to this session.
Hello, doctor, can you hear me?
Yes, yes.
Very nice presentation and very simple presentation. And what you said is, I took a class 3 days back with my friend, and that time I also discussed all these things, how we can do many things we can do, because a huge amounts are using for this allopathic treatment and for the surgery. We are simply giving some medicines and it may clearly. Okay. Then even in arrhythmia and atrial flutter and all these conditions, I have met many cases, and at that time the heart sounds will become normal itself. So that's what we can do. So your class was very nice, and I am very much appreciate you that dissolving the clots and dissolving the fibrous contents. That is very important in our management of homeopathy. Thank you, doctor. Thank you very much. You're always welcome to our talks.
Now it is the time to wind up the session. I invite Dr. Rambaresa to add something more to this set, as well as you can say more to thanks to the session. And before that,
yes.
Yes.
Thank you, Dr. Dhanesh ji and Dr. Manoj ji, Dr. Hubert Disalva ji, everyone, namaskar, and congratulations, Dr. Deepak Tyagi.
Thank you, sir.
Very nice presentation, excellent session. A class of physiology and anatomy, just like physiology and anatomy, and heart valvular diseases. Good describe.
Thank you,
Many
sir. Thank you
kinds
so
of
much.
medicine, and according to miasmatic, sora, psychotic, and syphilitic, and pseudo-sora symptom. So very,
Thank you,
very
sir.
thanks. And only one word, fear. Fear is a 50 say above diseases, according to only one word, fear. Fear is a very
Yes, sir.
important. And emotional, many emotional causes. Lekin teach the patient according to law of homeopathic science. Teach the patient, not the disease, according to similarity. So very, very thanks. Behalf of IFPH, Dr. Deepak Tyagi. Again,
Thank you so much, sir.
Thank you. Very, very thanks.
Thank you,
Thank you so much.
Dr. Rambaresa and Dr. Deepak Tyagi, and those who attend the session. And tomorrow we will have a session from Dr. Jessica Mandradio, and she will be talking about effective communication for patient care. She has done the first part last month, and tomorrow it will be the second part. Hope all of you will join us by using the same time. Thank you all. Good night. It's over to
Good night, sir.
Dr. Manoj.
Very good.
We'll have a session. Thank you.
Thank you.